Hi guys, welcome to the HealthyCare Podcast, where we literally bring the why back into healthcare, and we talk about everything related to health and wellness. My name is Catherine Okubo, and I am your host, and we're filming directly from our studios here inside MPB Health, your go-to alternatives for traditional health insurance, offering innovative health sharing plans. Today we're excited to have Lauren Decicco, a doctor of physical therapy. Lauren has over 16 years of experience and primarily focusing on nervous system regulation and care. And today Lauren has her own private practice where she uses different modalities for a full body transformation. Welcome, Lauren.
Thank you for having me.
Lauren, let's just dive in. Tell us a little bit about what do you do? What does it mean to be a doctor of physical therapy?
So my clinical background is a doctor of physical therapy, and I have had over 16 years of clinical experience, and very typical in the beginning, working for outpatient physical therapy practices and really staying in the mainstream healthcare setting. But over the past 6 to 7 years, I've really transitioned out of mainstream care into more of a holistic approach, and have taken my background of really traditional PT and blended it together with a multi-system approach so that we can accomplish and achieve a full body healing experience. Because ultimately, our bodies are meant to be able to heal to a certain level on their own. We just have to create a foundation that really, really sets the tone for that healing process to happen. So when I go in and do traditional PT modalities with my clients, I want to do that on a system that is set up to really promote that healing. So really making sure that the nervous system and the body feels safe. It's not stuck in a state of survival. Because if we're stuck in survival, we are really driving increased pain and inflammation and tissue tension. And we really can't heal our tissues that we're dealing with injury or pain in if we're stuck in that state. When we transition into safety through nervous system regulation, then it helps to promote the healing process all the way down to a cellular level. And then from there, I start to work through other systems in the body that help to really balance out the system so that it can handle all of the different interventions to the highest capability. Like lymphatic system work is really, really important in our care. And then transitioning to the localized tissue or the localized complaint that the person is presenting with.
Yeah, I really like that because, the traditional, healthcare, it's only looking at that one physical thing, but you're taking an approach from different angles because the pain itself doesn't just happen because of a specific injury, right? It could be a much deeper reasoning from it.
Right. So, over the years of what I've seen is we don't get to where we're at in our health or our sickness or our injury from one incident typically. It is typically our entire environment, our emotional, what we're exposed to day to day, and our work environment and our relationships is all impacting our bucket essentially of what we can handle in our life. And it could be one thing that overfills our bucket or overflows our bucket and creates that injury or that illness in our system. So it's not just one single thing that's necessarily going to heal us. So I definitely think it's important that as practitioners, we look at a person as a whole being and that they're also very dynamic. They're not cookie cutter presentation typically. Everyone has had a different experience that has led to where they're at that day. Even a singular person that I see can show up in a variety of different ways in different sessions that I have with them. So really looking at them as a flexible, dynamic human and that we're not shoving into a box. So as a single practitioner, I look at it that way, but I also really, really believe in collaboration with other practitioners. I know in my own health journey, it took a team to get me to where I'm at. So I think that a multidisciplinary, collaborative approach is really, really important in care as well.
So basically you offer a customized type of program, right?
Yeah, it has to be individualized because even if client A comes in with a knee pain and client B comes in with knee pain, there could be so many things that are factors in how they recover from that knee pain. Yes, there are modalities that are evidence-based practice modalities and interventions that work for knee pain that I definitely integrate from a traditional PT standpoint, but more from the holistic approach. I look at, what does their nutrition look like? What does their environment look like? What part of their nervous system are they operating from? Are they in a regulated state, really nice and balanced out and feel safe and secure in their environment, meaning that their inflammation and their tissue is going to heal much faster with traditional modalities? Or are they somebody that's presenting stuck in a state of fight or flight, survival, driving more pain and inflammation and tissue tension? So they're going to need a little bit different approach to their care than just the traditional interventions.
Yeah, no, definitely. And with the talking about the fight or flight and the nervous system, I think we were just talking about this before we started filming, but the same situation can trigger people completely different. So basically you work on the root cause of that problem to make sure that whatever is triggering that person, it will have a different response from them.
Yeah, so we don't always have to know the root, but having awareness of your system's response to an interpretive trigger. So whatever that trigger may be for different people, it could be like eating the wrong food that doesn't sit well with their system. It could be a toxic relationship. It could be, there's so many varieties of what our system is perceiving as a threat that is then driving too much survival response. So we can change and rewire how our system is perceiving those stimulus from our environment. We don't necessarily have to focus so much on the environment because our environment is going to be what it is sometimes. I mean, some of us have the ability to change our environment and sometimes we don't have the ability to change.
We really can't control it. Yeah.
Right, but what we can control is how our system is perceiving and responding to the environment. So one of the greatest tools that people can take and understand and integrate for themselves is understanding where they're at in their nervous system. What is the state of your nervous system? So then you can understand the subtle cues and shifts and then bring yourself back to the most optimal state. So that is a super powerful tool that I give a lot of my clients, is educating them. What does it look and feel like when I shift into survival in response to an environmental stimulus or trigger? Because we don't necessarily have to take that stimulus away, especially if you're a high performer that is exposed to high stress all the time. We don't want to take high performers out of their job.
Right. Yeah.
We want them to have a different relationship with their stressors so that they can really optimize their performance without burning out in the end. So it's not always about the actual stimulus itself. It's about the perception that your body is interpreting the stimulus as. Is it a threat? Or is it safety? And we can teach safety back into our system through different practices so that we can change our interpretation of that threat.
Yeah, and it takes also some sort of like consciousness from the person to even realize that they're having these responses, because I see a lot of people that are not conscious about how they respond or how they get triggered. They don't even realize that they're getting triggered.
Right, because we have really detached from a lot of the signaling. Or if you have been in a chronic state, under chronic loads of stress without any sort of downtime or recovery, or flexing out of that fight, flight, survival response. And it's not just fight, flight. There's other categories that we can consider survival as well that people are aware of, which would be like functional freeze or burnout or shutdown too. So it's like too excessive fight or flight, too much activation. And then there's also the other end of too much deactivation, where that's where we kind of sit in burnout and crash and burn. Our system is actually shutting us down and immobilizing us because we've been under stress loads for too long. So our goal is to start to get people to have a little bit more internal awareness of where they are at in their system. But that requires people to like reconnect with themselves a little bit. And that can be scary and uncomfortable. But there's ways to approach it where we can induce safety into the system before we start practicing a lot of that, because we have to feel safe enough within our body to start to reconnect with it, to then start to analyze, like, where am I at in this body and in my environment. Yeah,
it's basically like having a relationship with yourself, kind of.
Yeah, it's that mind-body connection and having that somatic experience, that felt sensation of what the body is signaling to the brain. Because that is actually how our awareness of what we're feeling mentally, interpretation of what we're experiencing and feeling comes from our body. And those messages signal to the brain, and then the brain creates its story around it. So that's why an experience for you and I could go through the same experience, but that experience for you could be very different than the experience for me.
Yeah.
Because of the information that's coming into my body, and then the story and mental understanding of it, the processing of it is very different for me than you.
That is true. That is true. I like to study about neuroscience, and that's exactly what it says. You know, our brain are interpreting all these different signals from the environment completely different.
Yes.
And it has a lot to do with the nervous system too. So what are some of the modalities that you actually use when working with your clients?
So when I'm in person with people, I do a lot of the regulation for them. So the first thing that we need to do for people is we need to make them feel safe. And we need to bring their system back to neutral, balance back out. So meaning that the fight or flight response and the rest and digest response are balancing together so that we're back in a neutral zone within our nervous system, that we're not in excessive states of either. So we like to call that like their window of tolerance, and I'm bringing them back inside their window of tolerance, back to neutral baseline. I do that through my nervous system initially. So I co-regulate with my clients. So my nervous system is nice and regulated and balanced as they come into my space, as we're engaging, even on a phone call. So the voice tone, eye engagement, being able to listen and hold space, and even my space itself feeling safe for that person to come into so that their system can downshift and regulate itself. And so I'm helping them to regulate, but then I also use different modalities on the body to, for example, stimulate and activate the vagus nerve. The vagus nerve, when we activate it, it has direct access into the parasympathetic, and it signals safety. So it's a stop button for excessive activation to help balance people back out. So when we activate that, it brings the body back into that neutral zone. So I start with a lot of vagus nerve work, and that's very, very simple technique for a lot of my clients to go home and practice daily as well. So really getting that nerve to kick back in so that physiologically our body has a better adaptation to stimulus or stressors in your day-to-day experience. And then there's it depends. So it depends on the person. A lot of people who are experiencing nervous system dysregulation or survival responses, and that could be someone who has an acute injury because their body is clearly trying to defend itself, all the way to somebody who's, a high performer under chronic loads of stress. They're still going to present with a lot of similar tensioning patterns in their body. So bracing through their abdomen, tightness in their hips, tightness in their shoulders, clenching in their jaw, and going into the body and helping to release that from the body, doing fascia work, soft tissue work. Sometimes I'll use a method called dry needling to help release the tissue tension, or they're having pain in those areas, try to release that as well. Because we're teaching the body that it's okay, it can let go. It doesn't have to hold these patterns to keep it safe anymore, which then tells the brain, okay, I'm safe in my body. So we want to rebuild that brain-body connection. And I teach a lot of people like somatic exercises and neurological type of exercises that again start to signal safety by teaching the body and the brain that it's safe to be there. And, some other things, it depends on the person if they have other things like what we call the vestibular ocular reflex, and then also like our proprioception, our awareness of where our body's at in space, and our balance, that can all be affected by too much survival response in our nervous system. So going in and doing some different exercises to help retrain that and help the body be aware of its spatial perception in a more accurate way will also help the body feel safer in its environment.
Okay. And what about, let's say people that have some sort of like really chronic pain and they've done everything, stretches, they've done the physical therapy, they've gone to rehab and it still doesn't go away. Like, what would somebody need to do for that?
So their system is really hardwired, that pain signal from the body to the brain. It's like this cycle that keeps going, and it's obviously going to drive excessive states of sympathetic, fight flight, because it's trying to protect itself all of the time, which is then going to make the body have more tissue tension and more pain. So we want to break that pain cycle somewhere. And so I feel like really, really addressing, one, bringing the body into safety. They're going to have to do it a lot over and over and over again and very repetitively, because the body wants to stay stuck in survival. So the people that are dealing with more chronic issues are going to have to do a lot more daily, routine, repetitive signaling of safety and regulation to help bring their body out of that until it starts to hold longer and longer. But that is one way to start to downshift that cycle of pain going to the brain, to the body, around and around and around. But then, doing some other modalities like we would typically do with like soft tissue work and things like that, because it started with mechanical pain at the soft tissue structure, but it got hardwired into more of like a neurofeedback loop of pain signals to the brain. So finding ways to break that. And then ultimately we want people to return to higher levels of activity. But we have to address the pain cycle first, because if we just go throw a bunch of strengthening exercises on top of pain, those muscles don't want to activate the way that they need to, and we can actually drive more pain. We want people ultimately, though, to be high functioning, strong, and, resilient in their bodies, but we first have to address the pain cycle first and make them feel safe again.
Interesting. So it's pretty much like breaking the signal pattern between the pain
a pattern interrupt, essentially.
Wow. And I know that you also work with a lot of people that have like autoimmune diseases. What would you say, like, how does that work? What would you say it's the cause of it, and how do people get over it? Like, right, because the body is pretty much attacking itself.
Yeah, so we can't say exactly what the cause of that is. I think it's a culmination of many things. Suppressed emotions, their system, genetically speaking, might be more predisposed to an autoimmune disorder, history of stress, like CPTSD, for example. Complex PTSD is really linked to increased autoimmune. Women are more likely to have autoimmune than men. So there's a lot of different factors that go into autoimmune. But one way to help people with autoimmune flares, we're not necessarily going to make the autoimmune go away and non-existent, but we can make people very, very low symptomatically speaking, so that their inflammation and pain is much more under control through approaching the things that drive the inflammation. Obviously, like gut health is really important, but the nervous system is huge because it has direct connection to that inflammatory and immune reflex. So when we go in and signal safety to it and start activating the right parts of the nervous system, then we can start to transition and change some of those inflammatory processes as well. And those are great tools for people to do for themselves. It's not like they have to go see a practitioner for forever because they have this autoimmune condition. But if they learn the tools and then they have flares, then they can apply what they need to around those flares and really, really control the symptoms.
Yeah, that's a good approach to kind of like manage the situation. And talking about the system and nervous system, how can somebody tell, like, is there any physical signs that a person can tell that their nervous system is dysregulated?
Yeah, there's a lot of physical signs. So, and a lot of people, you talk to people and they're like, I'm not stressed out. Like, well, usually because they're super high functioning and they're getting a lot of stuff done. So that productivity to them equals like, I'm not stressed out. So it doesn't always have to look like I'm not getting stuff done to equal I'm stressed out or I'm not functioning well to mean that like I'm not doing well. But so increased tissue tension. So if you catch yourself where you're always clenching your jaw or you're bracing or you're holding your breath, hypervigilance, irritability, changes in your vision, like being sensitive to light. People will often complain about ringing in their ears or feeling like they're getting tunnel vision. Obviously, you're going to have gut issues with chronic nervous system dysregulation because we've turned off healthy digestion in these states. So, and I ask every one of my clients, do you have gut issues? And almost every single person has some sort of gut issue related to when they are supposed to be going into rest and digest and eating. But a lot of my clients also have like chronic gut issues like IBS as well. And this started in childhood and got progressively worse. And then we talk about their childhood and how much they realize how stressful it was and that they were always like a very sensitive child and taking on everything and how it's showing up in different parts of their body. But so digestion is a huge one. But on the other side of it, so that's more being hyperactivated in those states. And you're also going to notice that you're going to be like less resolution oriented if there's like conflict. You're going to be more combative, more aggressive.
Like defensive.
Anxiety sits here as well, more defensive. Yeah. So, and you're not going to really want to engage socially. You're going to be more pulled away or like irritated by engagement than anything. So then if you look at the other side of it, too much shutdown, like too deactivated, this is where you're more dissociated. So you're really disconnected with your body and where you are in your environment, really retracted and pulled away from that. Again, you're going to have visual changes here. You could have low tissue tension here. You're going to be lethargic. You're not going to be motivated. You're not going to want to get out of bed. This is where bed rotting
Less
sits.
energy.
So when people sit and doom scroll all weekend, like they were super, super productive all week, and then all weekend they sit and doom scroll on their couch or in their bed, they're probably trying to recover from being too activated all week, and now they're on the opposite end and too much deactivation. You're also going to have depression sitting here because, again, you're more immobilized and shut down. Digestive issues are also going to sit here. You can't have good digestion in either sides of this. So, but people will be called, they're not motivated, so they're self-sabotaging here. They are, like, not pursuing things. This is where people who are, like, a professional, they might feel stuck because their nervous system is actually deactivated. So they're really having a hard time getting momentum to move forward in a project or something like that. So we get a bad rap for our personality traits or our behavior, but it's a lot of times really linked to where we're sitting at in our nervous system. And it's protective survival mechanisms. The behaviors are around that sensation that we're getting in our system to basically keep us safe.
Right. Yeah, because everything is about the brain does everything to keep you safe, but it's not technically going to be the best for you.
Yeah, it's going to do what it knows kept you safe early on in life. And even if it's not productive or a positive, it's going to do what's familiar over And like, even if it's a familiar hell, it's going to choose that over an unfamiliar heaven. That's like what we like to say about it. So you're going to ask yourself, why do I keep doing this? Every time I have this opportunity, why do I ruin it by like not completing the task? Or I get sick every time I'm supposed to go do a public speaking event. That's your body like subconsciously trying to protect itself through the nervous system, because it learned how to keep you safe or like unseen so that you didn't ruffle any feathers or whatever it was early on throughout your childhood. And it's presenting that way now as an adult. But it doesn't mean that's who you are permanently. If you can shift your system, you will present very differently to the world.
Yeah, that's true. And why does pain so often keeps coming back for some people?
It gets hardwired into your system. So those pain receptors, so we have a mechanical injury, meaning I twisted my knee and I overstretched some of the soft tissue structures like the ligaments or the tendons. And those pain signals travel to the brain to tell you something's gone wrong there and we need to address this. And over a certain amount of time, some of those tissues, they should be healing properly. If not, then, whatever you've done to heal those tissues, mechanically speaking, like a surgery or the therapy or whatever, over a period of time, structurally should be healed. If we have ongoing pain beyond that, then your body has hardwired those pain receptors to basically be stuck on. And it will actually start to lay down more receptors over a longer period of time. And we can actually create more pain by focusing on it more too.
That's interesting.
Yes, we can start to, this is why people have like a phantom leg pain, for example. Like they get an amputation, the limb is no longer there, but their brain still thinks there's something there and it's painful because it started to lay down pain receptors and the brain is thinking, like bringing awareness to that. So we can, if we're not addressing the body part with the pain through proper modalities and positive reinforcement around it and things like that, then our brain starts to really, really hardwire and map that signal, and it can grow in size. Like if I hurt my knee and I think about it all the time and I'm like, it's consuming me, my brain, the only part of the body that really has awareness coming to my brain is my knee, forgets about all the other body parts. So we can start to break that also by introducing what we call novel stimulus or new stimulus to different parts of the body to help the brain remember there's other parts of the body. Like we don't have to be so consumed by this one body part. So there's a lot of like neurosensory type of information, proprioception, and modulating, changing our body or our brain's perception of the signals that it's receiving that can go into helping with that chronic pain for sure.
So basically we can make our pain bigger or smaller by just focusing on it.
Yeah, so if I have clients that have multiple body parts and chronic pain all over and they've been suffering from it for years and years and years, one thing that we practice is a pattern interrupt. So they'll often get stuck in this loop of this hurts, this hurts, this hurts, this hurts. I'm going to do this, 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 this. And they keep going in this cycle of like hurt, intervention, hurt, intervention. And they just get stuck in this feedback loop. So anytime they start doing like a body checklist of all the parts that hurt and are bothering them, we interrupt that pattern. They have an assignment, like every time I catch myself doing a checklist, I'm going to find 5 things in the room to interrupt that. So they're basically teaching their body not to be so like hardwired to pay attention to the pain all the time, so that the pain starts minimizing and growing smaller in their system.
Yeah, it's the mind is a very, very powerful thing. I know that also you work a lot with like the lymphatic system. How does the lymphatic system actually affects us overall, our stress levels and everything?
So our stress levels can affect our lymphatic system, and our lymphatic system can affect our stress levels and our ability to heal itself. Our lymphatic system, they are vessels, and it's a system that basically cleans and clears the cells and the fluids in the body. It's in every part of your body, flowing along all the different vessels and nerves, all the way around your brain, all the way down to your limbs. And if it is backed up or stagnant or not doing its job, because when you're not moving a lot or you're really stressed out, so you have more muscle tension going on in your body, which is clamping down over those vessels and not allowing the fluids to get to where they need to go, then we are not clearing out and detoxing our body properly. So we're going to end up with cells that aren't regenerating in a healthy way. Our cells aren't going to have space to bring nutrients in. And so you could take all the best supplements in the world, but if your lymphatic system isn't doing its job and creating space in the cells and clearing out all the garbage, you're not going to absorb the good stuff either. So we want to create space in the cells so the bad stuff's out, the good stuff's coming in, the cells regenerate properly and lay down and heal properly. I have somebody come in and all of their injuries they've ever had are all in their lower body. I'm going to think to myself, something's not going on, or something is not clearing in somewhere between like their waist level or below. So it could be anything like above there that's really backed up and creating lymphatic fluid stagnation so that those cells aren't healing as well as they could. So if we have like reoccurring injuries, for example, we want to look at the lymphatic system. If we have puffiness in our face and our limbs, if we're holding on to weight, again, digestive issues, if we've had a lot of infections or we get sick very easily, brain fog, acne in the face, like all of those can be linked to a backed up lymphatic system.
So basically the lymphatic system is just a way for us to detox.
Clean and clear out. So think of like a fish tank and there's a filter. If that filter gets backed up, that fish tank gets all gunky and disgusting. Yes. So we want that flow to keep going and going and going. Oh, wow. So our system should pump itself. It has valves in it that help that open and close and move the fluid around the body. But because a lot of us sit a lot all day, we're not super active, we're really stressed out, we don't eat healthy foods. Really, the biggest thing is we're stressed and we don't move enough. Every single person would benefit from doing a little bit of lymphatic system stimulation. So I don't do lymphatic massage in my practice. I just help people learn how to stimulate different points. Like I will manually stimulate different points to encourage the system to do what it's already supposed to be doing. And then I teach my clients how to do some of their own little self routine every single day to help clear.
Yeah, so I used to do a lot of lymphatic massage for more the aesthetic purposes, you know.
But you were still getting the benefit of.
That's what I was gonna ask, because maybe I should go back to do it like would you recommend it once a month? Like
it depends on the person and what their goals are, but also if they're struggling with something in particular. What they have access to, like at home, you can do bouncing. You can do, a lot of people are getting vibration plates. So standing on a vibration plate will help stimulate the system. I have a lot of my clients get a ball that vibrates and going over different points that commonly get stagnant and backed up to help clear those points so the system flows on its own. And then, but yeah, if you have access to being able to go to a lymphatic specialist and doing a massage or a routine or something with a professional, I mean, that's amazing too. So you would have to just track like how your body is clearing. You might have to go more frequently in the beginning, like maybe every week or every other week to really get the system cleared and moving, and then kind of maintain in between that.
Yeah, I mean, like I said, I was really mostly going for aesthetic reasons because it helps with weight loss.
Oh, definitely.
And like, you know, have a smaller, like your measurements get smaller too because it's less inflammation on the abdomen. So that was the reason, but I didn't know it had all these
actual health healing benefits at a cell. Yeah, so your cells can regenerate better. I mean, I had a video on my social media account where it was like after Thanksgiving. So I hadn't done any of my usual routine and I was super puffy. You could see it in my face. You could see it in my tummy. And literally I just started doing this basic routine. It's like just stimulating 6 different points in your body for like the following 3-4 days. And it was a 6-pound difference.
Oh, wow.
Before and after that.
Oh, wow.
And you could see it in my face, like how it was sitting in my neck and my cheeks and stuff. So a lot of people think they're holding on to weight, and a lot of times it's fluid.
Wow. Yeah. See, guys, if you want to lose weight, just start looking at the lymphatic system. That's awesome. So let's see what else that we haven't touched base on. I think we talked almost about everything that we wanted to mention here. Is there anything that you think it's important to say to anybody that's listening, related to everything that you work with?
I don't think that there's anyone out there that's not dealing with some level of stressor or feeling a little overwhelmed, or can tell that their system is sometimes dysregulated and it starts to affect your health and wellness, but it can also affect your behaviors and your relationships and your performance. So I think it's really important to be aware of how we're showing up for ourselves in the world. And one of the simplest tools that you can do is start to notice the subtle shifts, but also start to practice just some really basic daily vagus nerve activation or regulation, parasympathetic breathing techniques, vagus nerve stimulation, which you can find 100 different ways to do that online. But I like to teach a very, very simple breathing technique. It's just focusing on a long exhalation and humming with it, and practicing that daily every morning. But then also, if you can feel yourself start to get stressed or triggered or activated, do that in the moment around that stressor, so that you start teaching your body and your system to respond differently to it. So just having awareness of these state shifts and a little tool to help you regulate can create a huge, huge change in your life and also in your health. So it's really important to understand this stuff.
That's true. And meditation also should help, right?
Meditation, it can be difficult in the beginning for people if they've suffered from a lot of PTSD, for example, or it just depends on each person's history. But working your way towards meditation when you have the capacity for it is also very, very important, because that's where you spend time sitting with yourself and creating that reconnection between your mind and your body, and, spirituality and things like that as well. But you get a lot more in tune with yourself, and, a lot of emotional processing can happen with these practices as well. And it's really important that we do experience emotions and process them, because storing that and suppressing that leads to a lot of illness as well.
That is true. And everything that you suppress kind of ends up getting back into
it's going to show up 100 times
and worse,
more intense if you don't process. So I never tell people we're doing this regulation so that we just feel better. We are trying to feel safe, so then we can approach whatever is in front of us differently. So if that means I need to still process this emotion, we're still going to process the emotion and experience the emotion, but we're just experiencing it from a different place in our system.
Oh, okay. Well, that's really great. Thank you for sharing all this wonderful knowledge with us. It's super interesting.
Yeah,
how can people find more about you online?
So I do a lot on my social media. So I post a lot of information of how to do some of this for yourself, at least to stimulate the conversation and get you thinking and researching as well. So that's on Instagram and TikTok. It's dr.laurendecicco DPT. I do have a website. It's drlaurendecicco.com. So there's ways to work with me, and I do virtual and in person. And I am working on curriculum and programming to help people learn how to do all of this stuff for themselves, especially in the environment of high-level professionals and, entrepreneurs and leadership and organizational wellness.
Okay, wonderful. Well, thank you so much for being here. It's wonderful work that you do.
Thank you.
And thank you guys for watching another episode of the HealthyCare Podcast. We'll see you on the next one.